Thank you, Mr. President, colleagues of the Senate. I rise today to speak in support of LD 424 because this really is just a common sense continuing service budget. Like my good honorable colleague from Cumberland, I served as mayor and councilor in Bangor for many years during the 2010s. Every year that the legislature was in session was a test of will, a test of fortitude about what public services we were going to be able to maintain, what layoffs we were going to have, what cutbacks we were going to have for teacher retirement or school districts. People forget that there was a whole bunch of cuts and reductions and layoffs. The public health sector for the state of Maine was fortunately at least partially rebuilt in the last 4 years while we had a pandemic. But for municipalities and public schools, this is a welcome budget. This provides certainty and stability to municipalities all over the state and schools all over the state. As chair of the Health and Human Services Committee, I know just how important this proposal is to the health and well-being of Maine people, and I worry that that message is getting lost in this debate. It is a budget that provides health insurance for more than 128,000 Maine children so their parents can afford to take them to the doctor when they're sick or injured. It is a budget that improves access to prenatal and postpartum care for expectant mothers to boost health outcomes for newborns and parents. It is a budget that provides critical funding for nursing homes, residential care facilities, hospitals, and other long-term care providers. It also continues funding to support the wages for direct care workers who provide quality, compassionate care for Mainers in long-term care. Last year, the Maine legislature reduced the wait list for older Mainers eligible and waiting to receive in-home services to assist with day-to-day tasks. The continuing services budget honors that commitment and continues funding this program at the same levels. The continuing services budget funds the low-cost drugs program for Maine's elderly, providing relief for thousands of Maine seniors. The high cost of prescription drugs is harming our seniors who need this medicine to survive. There are much needed investments in the health and well-being of Maine people. I know there is a lot of work that we still need to do, but this budget puts us in the position to address new initiatives in the Part 2 of the budget. It provides our healthcare providers with stability that they deserve and that we all need to continue serving our communities. Let's pass this common sense current services budget today so we can roll up our sleeves and get to work on all the new initiatives that we want to include in Part 2 tomorrow. Let's show people that this is not Washington, D.C., this is Maine, and we can work together and govern responsibly, and we have done it many times before.